Welcome to the PEM presentation. I am Dr. Letitia Plummer, practicing dentist in Houston, Texas in the Pearland area, and also a VIVOS provider. And I am so excited that you're watching this video today. Maybe you're watching this video because someone has told you that there's a correlation between not sleeping well and ADHD, bedwetting in children, mouth breathing, restless sleeping in your child, or maybe as an adult, depression, anxiety, fibromyalgia, hypertension, Alzheimer's, and diabetes. You're watching this video because you understand that you don't want to be on medication, nor do you want to keep your kids on medication. And so we're going to explain to you exactly how not being able to sleep well is directly correlated with the issues I just mentioned. We are seeing a silent crisis in America. If you look at the left-hand side of the screen, you're going to see symptoms that children typically have. Things like ADHD, bedwetting, difficulty in school, mouth breathing, snoring, crowded or crooked teeth, dark circles around their eyes, and daytime drowsiness, just to name a few. If you look at the other column, these are issues that adults typically have problems with, such as depression, anxiety, fibromyalgia, obesity, hypertension, cancer, dementia, and diabetes, just to name a few. Research has shown that 9 out of 10 people in America suffer from one or more of these conditions. So now what we're going to do is we're going to look at a few images of children. And in these images, we're going to see some specific things that stand out. And that's what I'm going to point out for you, so you can begin to understand and what to look for in our children when you come into our practice. And that way, when you meet with your dentist, you'll understand a little bit more of what we're looking for. So if you look at this first image, you'll see Michael. He has a retrognathic chin. His chin kind of moves a little bit more inward. If you look around his eyes, you start to see some venous pooling, which is a little bit of a gray shadow around his eyes. The symmetry, if you look right between his eyes, right down his nose, the symmetry is a little bit off. He seems to be tilting his head a little bit, and the whites of his eyes are much whiter than normal. Okay, so the little girl in the middle, you can notice that she's got dark circles under her eyes, and that typically is called venous pooling, and that primarily is indicative of the underdevelopment of her maxilla, and her chin is quite small. And look at the little guy on the far right. His symmetry is a little bit off. His double chin is present as well, which just basically means that his lower chin and jaw is underdeveloped. So he's probably a mouth breather. Okay, so these little girls, look at the one to the far left. You'll see that she kind of has her head tilted a bit to the side, and that's a cervical head tilt. And so she's posturing over to the side, or sometimes they move their head forward, and that's typically they're trying to breathe, they're trying to open up their airway. They're compensating. She also has dark circles under her eyes and a very, very long oval face. The little girl in the center, she has a little bit of asymmetry in her ears, really tiny chin, severely underdeveloped in her lower jaw. She can't even close her lips altogether, and her teeth are exposed. She also has what we call sclera. So even though they're looking right at you, you see a lot of whites in her eyes. And the one in the far right, she just looks tired and sad, still very, very small chin. Her head is tilted. So the general image of all of these children is that they look really tired. And so what my question to you is, when you look at your child, do you notice these same types of appearances in them? And that's the main reason why we're having this particular conversation. The largest goal of this is that if we don't handle the issues that we're seeing in them in childhood, these specific problems will follow them into adulthood, and that's something that we don't want to do. On this slide, it's a great demonstration of how all of these issues kind of come together. So visible symptoms are everything that you see on the branches of the tree. So in this particular diagram, it really shows how the visible symptoms relates to the underlying cause and then relates to the possible root causes. So if you look at the visible symptoms, these are the things that we're either going to see in our office, or during our questionnaire, we're going to ask the parent of the child or ask you as the patient what is going on. So symptoms like ADHD or ADD, sleeping issues, defiance or aggression, nightmares, daytime drowsiness, bedwetting, restless sleep, crowded or crooked teeth, snoring, mouth breathing, difficulty in school, chronic allergies, even dark circles under the eyes. So all of these particular symptoms can always go to or be related to. So all of these symptoms can be related to underlying causes, and that underlying cause is a compromised airway. A narrow dental arch or an underdeveloped upper or lower jaw directly relates to a smaller airway. And that is why the particular treatment that we have for this really assists with widening a underdeveloped arch. Why did this happen? Why does 80% of our children have to wear braces? Well, the possible root cause is that they were on a soft diet too long, their tongue is not strong, it's weak, and they ate too many processed foods as they were developing. When they're on a soft diet, they typically have very weak orofacial muscles, which are the muscles in the face, a very low tongue position, or they'll thrust their tongue, which is pushing their tongue toward their front teeth. All of those particular causes can limit how they breathe and how wide the airway is. And most of them have these problems because they either had no or very little breastfeeding when they were children. So look at this particular image. Where did this come from? Why in this particular image does this child look like their front teeth are so far outward? And the large overbite that they have. This is the perfect example of an underdeveloped lower jaw and underdeveloped upper jaw. An upper jaw should be rounded, very arched like a horseshoe. And if you notice in this particular picture, this child's jaw is more in a V shape, which naturally will close or compromise the airway. This is really what we want to see. We call these the endangered species. Beautiful U-shaped arches, space in between all of her teeth. So we know when the adult teeth come in, there's going to be plenty of enough space for them to come in nicely. Tongue posture plays an incredible, important role as well. And it really is able to mold that palate, the upper palate, a nice horseshoe. And we call this the endangered species because we just don't see this enough. So what's happening? Do we just all of a sudden see or think that our teeth are just getting larger? No, absolutely not. Our teeth are the exact same size as they were before. We just have less space in our arches. This is a really good slide. This slide is an example of how normal craniofacial growth occurs. If you look at this particular slide, you can tell the skull is made up of multiple small lines. The inward line is where a 2-year-old's skull would be. And the outer line is of a 17-year-old. And you can see on this diagram, a 2-year-old's 55% of development has already occurred. In a 4-year-old, about 73% in males and then 77% in females. And by age 12, 89% in males and 94% in females have the total growth of their skull. Normal craniofacial growth is wider, forward, and downward. This diagram also shows and explains why we talk about children so much in this program, because if we can capture and guide their growth while they're children, then they can have an opportunity to grow where they should be by adulthood. Why are so many children suffering? We're going to dig into that. So we're going to look at some research that was done by Robert Corsini. And he's done about 30 years of research. He's written 7 books, hundreds of published articles, and really focusing on human skulls. He researched skulls from 400 years ago. What he noticed of the skulls 400 years ago, they had these beautiful U-shaped arched mandibles and maxillas. And then if you looked into more present time, they become smaller and more narrow. And what he also noticed is 400 years ago, they were able to have 32 teeth in their arches, whereas now 80% of children don't even have enough space for their third molars to come in. So what he wanted to do is he wanted to figure out, is this only happening here, or are there other population groups that are growing differently? So what he did was he looked at his findings among isolated rural populations around the world. There was history of breastfeeding for many years. Those children were on hard food diets when they were young, little to no incidence of crooked teeth or other degenerative diseases, and perfectly formed upper arches and lower arches. So these are the conclusions that Dr. Corsini came up with. after he did all of his research. The dietary consistency and toughness promoted proper bone growth. When non-resistant processed food became ubiquitous after industrialization, malocclusion or crooked teeth showed a rapid rise. And thirdly, soft diet or processed food increased underdevelopment of upper and lower jaws and malocclusion or crooked teeth. The population studies by Dr. Corcini showed as a Western culture and soft diets in these populations were introduced, dramatic changes in the rate of malocclusion. In the first generation, 50%. At the second generation, 70%. And by the third generation, 85% of children had malocclusion. Here's a fun fact. It takes 27,000 years for a genetic mutation to express itself, 51% of the human population. So the key to this is that malocclusion is not inherited. Many of our patients that come in say, oh, well, my mom had crooked teeth or he got his teeth from his dad. And that's actually not necessarily true. Malocclusion is a disease caused by Western culture. So the Western culture influence, what we have to understand is when we're breastfeeding, the tongue posture of the baby is actually up in the palate, and that muscle is helping form the palate. And when they're breastfeeding, they're working really hard. Their facial muscles are developing, their palate is forming properly. But when you're bottle feeding, the milk is just coming right out. The child doesn't have to work hard to get the milk to come out of the bottle. It just kind of rolls into their mouths. So they have weaker facial muscles. Their tongue doesn't have to move so hard against the palate. And the soft diet adds to that as well. And in breastfeeding, the nipple sits on top of the tongue. So we take them from the breast, then we put them to the bottle, then we introduce them to soft food diet. And we have caused our children to have underdeveloped upper and lower jaw. And this is no judgment to our parents. This is no judgment to mothers. This is just the way that it is. And we're just bringing attention to why this is happening at such a high rate. So in the Western culture, what do we see on the shelves? We see, foods that melt in your mouth. And they actually advertise that. We have Gerber baby juice bags that they basically just have to squeeze in their mouths. There's no effort. Our children don't have to use the facial muscles in the same way that children have to in underdeveloped countries. And this is why the children in underdeveloped countries have archways. They're such more rounded, and all of their teeth have the space to be able to come in properly, which directly relates to how wide their airway is. The way it should be, our kids should be chewing on carrots or eating broccoli and really, using foods in their mouths, obviously being safe, but using foods in their mouths that really force them to use those facial muscles and strengthen those facial muscles and have that tongue move toward the palate to help mold the palate in the right way. Research conclusions show that most malocclusion is acquired, not inherited. Malocclusion is unique to the Western culture, and presence of malocclusion is the key indicator of an underdeveloped airway. Okay, so we talked a little bit about tongue posture. Let's talk more about the research by Dr. James Sim Wallace. An early soft diet prevents the development of muscle fibers of the tongue, resulting in a weaker tongue, which cannot drive the primary dentition out into the space relationships with fully developed arches, which will lead to more crowding and permanent teeth. Okay, think of it like this. When you're building a house, you build it with scaffold, and the scaffolds allow us to create a shape of the house. Well, the tongue acts in the exact same way. It's a scaffold for the palate, and so it helps form the upper jaw. The tongue is a scaffold for the upper jaw. So look at the Gothic image of the teeth that are very, very narrow, and then look at the one with the more of an archway. See how nice and wide that upper jaw is? That is what we want. We want everything to look like a horseshoe, nice and wide. When the tongue is not able to get up and forward in the mouth, we see a lot of malocclusion, very narrow archways. So we see a lot of more of the Gothic arch versus the nice arch, very rounded. This is a really good image of what we're trying to explain. We see a lot of the Gothic arches, high vaulted palates, very crowded, crooked teeth. The tongue probably can't get up in that palate area. Whereas on the other side, nice U-shaped arch, lower palate. We know the tongue is able to rest in that palate nicely. Now let's talk a little bit about the maxilla. It doesn't only house our upper teeth. It also takes up the whole middle area of our face, the nasal cavity, the lower portions of the eye. So Dr. Guillemont said, our results suggest that dental arch expansion improves in patients with upper and lower jaw constriction and can be a valid treatment. So what exactly does that mean? So look at the image on the far left, very, very narrow. You see how short that line is? Very short. But if you look on the other side, it's a very wide, nice, longer line. The first image is more of the more moderns, 1940s, we see pretty consistently. On the other side, those are prehistoric. And that's exactly how it should be. And that's what we're talking about. We're talking about expansion. That expansion allows us to have a nice, wide, arched palate. The fascinating part of the lower CT scans is it actually shows and proves the wideness of the airway. And that's the green line. The green line indicates the airway area. And the yellow line indicates just the line in between the teeth. We call that the transpalatal space or distance. The functional airway is another example of what position of everything and how all of it comes together. So you see the nasal cavity, you see the archway, you see the part behind the palate and soft tissue, the nasopharynx, the oral pharynx, and the laryngopharynx. And as you can see, if the palate is nice and low and not pitched, it actually creates more space in the nasal cavity, creating the ability to breathe through their nose, which will naturally create a wider space toward the back of the throat, which is where the airway is. How we grow and develop in this region severely affects how wide our airway is. If we're very underdeveloped in that lower region and the lower jaw is pushed backward and jaws are really small, that's going back constricting the airway, especially the tongue. If the tongue doesn't have a lot of space in the mouth, then it's naturally going to fall backward and block the airway and make it very difficult to breathe at night. And that's where apnea or disrupted breathing comes in. So what does your airway look like? Do you want to be breathing through a straw or do you want to be drinking out of a garden hose? So in our practice, we take a series of CT scans, and this is the example of what a functional airway should look like. If you look at the first image, that's a severely constricted lower airway. The red area is the area of constriction. If you look at the next image, that's a typical mouth breather. The part in red is the area that shows constriction. Here, this is a child with Asperger's syndrome. Once again, a very, very narrow airway toward the back. And the final image is an image of a patient that suffers from sleep apnea. And once again, a tight, narrow airway toward the back, which makes it very difficult for the patient to breathe effectively. Okay, next we're going to watch a quick video. I love this video. It really shows in a very succinct way how growth and development allows our children to breathe easier and better.
Just a few hundred years ago, the human face was different. It was forward grown. Her wide profile and large dental arches ensured straight teeth and room for her tongue. Most importantly, she had plenty of space behind her upper jaw so she could breathe through her nose with ease. The modern face has changed. From childhood, her dental arches are less developed, crowding her teeth and giving her less space for her tongue, which impacts her airway. Many believe this stems from a number of causes, such as allergies that affect breathing. Another is the poor nutrition and softness of modern diets, causing toddlers to have underdeveloped chewing muscles and smaller dental arches. Because her upper jaw is too far back, she will struggle to breathe normally through her nose. To get more oxygen, she will compensate by opening her mouth to breathe, bringing her lower jaw down and back, creating a downswing of the face. This is how her undergrown upper jaw creates the appearance of buck teeth. She's actually compensating in order to breathe. If not corrected, the problem carries into adulthood. Extractions were documented in the 1600s as a way to treat crowding, Although they are a quick fix, they don't treat the problem of underdeveloped arches and have been implicated in harming the facial profile, making them the subject of much debate even today. In the 1800s, orthodontists in favor of extraction were looking for more effective ways of pulling teeth back, and this is where the story of headgear starts. Not understanding the cause, those orthodontists believed in a myth that in buck-toothed children, the upper jaw was overgrown. They thought that if they restrained its growth with headgear, the lower jaw would catch up and the teeth would line up. Although studies done throughout much of the 1900s have shown otherwise, this myth became a part of the foundation of conventional orthodontics. First, studies have shown that headgear suppresses the growth of both jaws, causing them to grow down and back into the airway, creating a clockwise rotation of the lower third of the face. The industry coined these deformities the headgear effect. The growth changes caused by headgear carry on into adulthood. In order to breathe, she will slouch her head forward to prop open her airway, creating a lifetime of neck and back pain. This is the infamous forward head posture. A simple physics diagram shows that the growth-stunting forces of headgear pass right through the skull. One study showed that headgear caused an abnormal rotation of the sphenoid bone, and no study has examined the impact of headgear on the skeletal blood flow and nerve pathways of a growing child, or its long-term effects. Having a healthy airway is crucial to the survival of life, and especially so during sleep. When muscles around the throat relax during sleep, a healthy airway stays open because the tongue is sitting forward and has enough space to be suctioned up against the fully grown palate. With underdeveloped jaws and dental arches, the palate is too small for the fully grown tongue, which is sitting back to begin with. When she sleeps, her tongue does not suction, rather it falls back and cuts off her airway. This is obstructive sleep apnea. Like crooked teeth, it's a modern condition, however, it can reduce life expectancy. Not surprisingly, obstructive sleep apnea is marked by the same traits that describe the headgear effect. Both jaws are grown down and back, creating a clockwise rotation in the lower third of the face. If you have already been exposed to orthodontic treatment that caused the headgear effect, there are ways to reverse what happened. If your child wears a headgear or is exposed to an appliance or practice that retracts structures involving tongue space and the airway, his or her lifelong health may be in danger. There are plenty of alternatives to these practices, so make sure to get multiple opinions. The myth of the overgrown upper jaw that needs to be held back has long since been replaced with science. Science has shown that young children can be buck-toothed naturally, and that the lower jaw catches up over time with a fully developed upper jaw. Essential to this is nutrition, the use of chewing muscles early on in life, and good breathing habits. This means breathing through the nose with the mouth closed and the tongue resting up against the palate. Also, the practice of maxillary expansion has been shown for over a century to correct crooked teeth and improve nasal breathing space. And since 1918, orofacial exercises have been shown to correct mouth breathing habits. There are better ways. Right to Grow is an organization dedicated to ending the practice of orthodontic growth stunting. Please sign our petition online, share this video, and get involved in making the world a safer, healthier place for our children.
This video was actually filmed by baby Eli's mom. It's a difficult video to watch, but I want you to watch this video and see how difficult it is for baby Eli to breathe. Let's watch this video.
Now he's holding it. That was holding it. He's still holding it. He's trying to take in air. There he goes. Okay, now watch. He's holding it. He's holding it. He's holding it. He's holding it. He's still holding his breath, and now he's going to gulp again. There he goes. That was it again. And again. He's holding. He's holding. He's trying to, there he goes. So this has been 3 minutes and 15 seconds, and you can see how many episodes he's had of not getting calm breaths in. Now, watch what happens when I take his jaw and I just bring it forward. If I can, let's see if I can. And I open his airway. Just bring his airway forward. Now listen to the quiet breathing. There we go. Now he's breathing through his nose. And I brought his airway. I'm opening his airway. Just pulling his jaw forward ever so slightly. And now he's breathing through his nose quietly. His mouth is a little bit open, but he's breathing through his nose. Just by, you hear how quietly he's breathing? You don't hear him anymore. And all I did is gently bring his jaw forward.
All right, look at this image. On the first image, the jaw is pushed back. There's no space in the airway. It's very, very narrow. It's a straw versus a garden hose. And this is what underdevelopment looks like. So now let's talk a little bit about the difference between nasal breathing and mouth breathing. What we saw in baby Eli in that video beforehand was mouth breathing. So what we know is when we're breathing through our nose, it's filtered, humidified, and moist air taking it through our nose. And we also create nitric oxide. It increases oxygenation, increases blood flow, and that gets to all of your organs very effectively. But that doesn't happen when we're breathing through our mouth. All that dry air, unfiltered air, is going to the back of our throats, and that's what typically can cause our tonsils and adenoids to be inflamed. Okay, so this is the research that Dr. Harvold did. He wanted to basically see what would happen with monkeys that were originally nose breathers that were forced to breathe through their mouths. And so he basically took cotton rolls and put it in their nostrils. And this was obviously done on monkeys and done about for a year period of time. And then after he removed the obstructions from their noses, everything went back to normal again. So he obstructed the monkeys' noses with cotton rolls. He forced the monkeys to breathe through their mouths. And so on this particular image, you can see the obstructed nasal breathing changes in the tongue posture. So imagine if we are mouth breathing every single day, what that does to the face. And you can see these before and afters, the changes that actually happen. And if our tongue is not up and forward in the palate, you can really see those high rates of malocclusion. So what we do know is when we have a compromised nasal airway and you're mouth breathing and you're on a soft diet, then you naturally will have low tongue posture. And mouth breathing causes tonsils and adenoids to swell, and that's why we see that in children very, very often. So we want to breathe through our nose at all times. We want to create nose breathers and not mouth breathers. So now let's look at some research that was done by Sten Linder Aronson. And this focus was done looking at the difference between nasal breathing and mouth breathing. And what we realized was that mouth breathing children definitely develop differently, and that nasal obstruction leads to mouth breathing and lower tongue posture, which leads to a higher rate of malocclusion. It's really important to promote breathing through our nose. Now let's talk about attention deficit disorder. And how does this remotely relate to not breathing properly? And we see a lot of children coming our practice with ADHD and ADD. If you have a child that is struggling to breathe, it's very difficult for them to focus and they're irritable. And what we understand and see is that there is a correlation of children not being able to breathe properly and symptoms of ADHD and ADD. So now what we want to do is we want to watch a video by Dr. Moralia, and he'll explain a little bit about the correlation between the two. Let's watch this video.
Now take a child, alter their quality of breathing and sleeping. And the real big issue now is how will they be during the day? So now you take a child who's 5, 6, 7, 8, it doesn't matter. Their issue has begun years ago. So it's not like you had 1 or 2 bad nights of sleep. You've had a poor quality of sleeping and breathing for years. And the parents have been struggling with so many different issues, and not the least of which is the ADD, ADHD discussion. Because the child who doesn't get a proper night's sleep with a good quality of breathing throughout the entire night is going to wake up and be unrested. And when you get a child who's had a poor quality night's sleep, poor breathing all night long, and you make that happen for years, you know what you've got? A 6, 7, or 8-year-old that's going to go to school and have trouble learning, have trouble sitting still, have trouble behaving, have trouble cooperating, basically have trouble fitting in to what is supposed to be a quiet and peaceful and learning environment. And it's not long after that where the phone call comes to the parent. And when the phone call comes to the parent from the school, what happens is, we have little Jimmy here and he's a little bit disruptive and we really want you to have him evaluated for ADD and ADHD. They're going to be diagnosed with ADD and ADHD. And our solutions are pharmaceutical. If we are given a pharmaceutical, it's usually in the form of some sort of a stimulant. And what that does to the child is it kind of pushes them over the edge and it brings them back to calm. So you basically take an excited or hyperactive child, you stimulate them more, and you bring them back to a so-called calm. But it doesn't make a better learning child. You're not going to have a child who's able to learn as well. So now you might have the child sitting still in class because they might be a little more numb or relaxed or calm, but it doesn't necessarily make them a better learner. If we have the so-called ADD, ADHD diagnosis, we're talking about hyperactivity. We're talking about all of the things about behavior and development that land in this category. And the interesting thing about research is, and there is current, ongoing, and past research that shows, children who are sleep deprived produce the same exact symptoms as kids who are diagnosed with ADD and ADHD. In fact, there's a nice study that showed children who were diagnosed with ADD and ADHD were mixed with children who were sleep deprived. And in that group of kids, when they tried to analyze them and look at their symptoms and diagnose them, they couldn't tell them apart. And if you have a group of kids and you can't tell apart who's an ADD child and who's a sleep-deprived child, it's no surprise that maybe the ADD and ADHD has a cause. And maybe that cause has to do with the quality of the breathing and the sleeping overnight. And there's a lot of research out there. And one of the pioneers here is Dr. Stephen Sheldon out of Lurie Children's Hospital in Chicago. And he does a wonderful job of researching, and over the decades, he's come to a conclusion, and I've seen him speak, and it's not soon after he jumps on stage and he makes a statement that ADHD and ADD do not exist. They are an outcome of a sleep disorder breathing. They're an outcome of a poor quality of sleep. It's all about the quality of sleep. Another researcher who's produced beautiful research on the same topic is Dr. Karen Bonnick out of Einstein at Yeshiva University. Dr. Karen Bonnick has the largest study to date. 11,000 children were watched over 7 years. And they were divided into 2 groups, sleep disorder breathing children and children who do not have sleep disorder breathing issues. The children in the sleep disorder breathing group, over their 7 years, her study showed that they were 50% more likely to be diagnosed with an ADD or ADHD diagnosis and treated with medication. 50% is a coin toss for our child to be diagnosed and treated with a medication. Also in her group, they were doing testing. They were doing IQ or intelligence testing along those 7 years. And the children with the sleep disorder breathing, their intelligence testing, their IQ scores were dropping over those 7 years. And that's really not the way it works when you're growing and forming. The formative growing years for a child, when they're sleeping and breathing well, your IQ raises to a certain point and then you kind of plateau. We don't see IQs diminishing amongst children.
So what can we possibly do? I want to introduce you to Connor Deegan, another video that we're going to transition into, but he has a really amazing story. And you're going to hear his story through his mom. So I would like to introduce you to Connor Deegan. And this story is written through the eyes of his mom. I love that video. It's always so touching to watch. Alrighty, so what can we do about all this? The essential role of dentistry. So now what we're going to look at is some specific cases of children that were actually treated by a dentist. So our first patient is Hunter, and he's age 10. And you can see a before and after. The before photo on the far left, and you can see some very huge changes between the two pictures. Specifically, that lower jaw area is more pushed backward on the first picture. In the next picture, he's a little bit more forward. In that first picture, you'll see his canines are impacted. In the second picture, his canines have come down very nicely into the archway. His bite's a little bit deep on that first picture, and after treatment, his bite and occlusion is in the most ideal form. He started feeling better after the first week. He stopped bedwetting after the first week. This is Paige. It was a remarkable transformation. Look at her profile, how dramatically it changed. The lower undevelopment of the jaw in the first picture, begin that forward motion. That forward downward motion really allowed that lower jaw to form nicely. If you look at the first picture of her teeth, very, very deep bite. You see, you could barely see her bottom teeth on that first image. On the second image, her bite opened a little bit. You can see her bottom teeth, really ideal occlusion. And maybe you'll remember Michael from the first video. And look at Michael straight on. He's not overweight at all, right? Look at that first picture of when he was age 9 and look at him at age 14. The double chin gave him the idea that it was maybe overweight, but he really wasn't. And all of these changes were done through an oral appliance. These are beautiful profile pictures of him. Look at that double chin when he was 9 years old and look at him now when he's 14. Really nice transition. All this is from an oral appliance. Now, Michael's airway, this is everything that we strive for. Making them feel better, live better, breathe better. And this is a CT scan. So you can see a before and after. Look how curved his skeletal structure is in the back. His lower jaw really, really pushed backward. And look how thin his airway is. Really breathing out of a straw back there. And look at that new image after treatment. Wide, dark area going down where the airway is. Nice, wide space. Plenty of area to breathe. No tilting. His head isn't moving forward. And now he's able to get the oxygen that he needs. But think about the toll that this takes on the body, especially when you're having a child that's suffering at this young age and then what they are when they become teenagers and adults. So now you're probably thinking, oh my goodness, if only I could have known. What about me? What about my spouse? What about my child? So now we're going to talk a little bit about, we've been really focusing on children, but now we're going to talk a little bit about adult and adult treatment. Now we're going to transition. So now we're going to transition into adult cases. I would like to introduce you to Dr. Tara Griffin. She's not only a dentist, but she was also treated with an appliance. So notice right away in the pictures, the gummy smile and just the changes in her face. She has a beautiful wide smile now, but before her smile was really, really gummy. Her eyes were squinty. But look at her after. Nice, big, bright eyes. Her teeth are much more proportionate. And so what she's going to talk to us a little bit about how she experienced it personally, but also how she is as a dentist. Let's watch this video.
I'm Dr. Tara Griffin. We are here today in my clinic in Panama City Beach. I've been practicing dentistry for over 11 years. Before I discovered the VIVOS appliance, I was suffering every day with chronic head and neck pain, TMJ pain. I was practicing dentistry and been practicing for 5 years, but I was already looking for an out. I knew that with this much pain, I could not continue to practice dentistry. I had chronic sinus and allergy problems, bronchitis. I was not sleeping throughout the night very well. I was waking up during the night. I had severe daytime fatigue where I would need to go home and actually take a nap in the afternoon, just at lunch, And so I was looking for a solution to the problem, but I didn't know what the root cause was until I learned about the VIVOS appliance. As soon as I started treatment with the VIVOS appliance, within the first 2 nights, I was sleeping soundly throughout the night. My energy was better during the day. The pain that I was undergoing took a bit longer to get resolved, but within the first 3 to 4 weeks, my pain level was reduced by 2/3 or more. Within a month's period of time, I was breathing through my nose better. I wasn't having the same sinus symptoms that I was having before. And within 3 months of treatment, my asthma had improved so much, I had no more problems with the inhalers and the frequency I was having to use with all of my asthma inhalers. My overall health started to improve very quickly. I was my own first patient. However, as I continued to treat the next patient and the next patient going forward, I was curious to see if they were going to have the same outcome that I had, and they did. 9 out of 10 had the very similar outcome that I had. So they were sleeping better in just a few nights, actually getting their energy back. They were less irritable. The pain that they had was going away very quickly. The teeth were beginning to straighten and align over time. So even though with this type of problem, it can take some time to get the long-term results, the immediate symptoms start to improve very quickly. Comparing my before and after picture with the VIVOS appliance, my smile was not symmetrical. My teeth were crowded. The gumminess of my smile was a major problem that I didn't like. I had unevenness in my eyes, also in my nose. My face was more round and less balanced, and that all helped to correct itself as well as I went through the treatment. When the VIVOS appliance is worn in the early evening and while you sleep at night, it allows the jaw to relax. It allows the airway to open up. It allows you to breathe through your nose and to get the oxygen that you need to the rest of your body for your body to begin to heal. By breathing through our nose, we are actually getting much more oxygen to our brain as well as our lungs, and we're producing nitric oxide, which is a vasodilator to allow the blood flow and everything to circulate better. And so a big component with this is it forces you to actually breathe through your nose to get the oxygen where it needs to go into the body. So that's a very important part of this. If you're interested in learning more about the VIVOS appliance, if this would be good for you, then I recommend you coming into a VIVOS center to be evaluated to determine if this is something that could help you.
Okay, this is a fantastic before and after photo. And these CT scans are just ways in which we record the progress in our office with our patient. The red shows constriction. We don't want to see any red. Fast forward to the end of treatment, the white and the blue, the beautiful wide airway. So the statistics behind this and the volume of the airway changed. It started at 7.7. And 15 months of active treatment, we went all the way up to 24. Let's look at a couple cases in adults. So I discuss a couple of things that we look for in our patients, in adult patients. So in the first photo, there's a couple of things that stand out to me. Long face, tiny eyes, the asymmetry in her face, double chin. Now let's fast forward 12 months. Look after 12 months. Look how different she looks. And this is only 1 year into treatment. So all we're doing is directing the body to do what it naturally needs to do. And in this particular patient, you can see the fantastic cosmetic benefits. Beautiful bright eyes, nice rounded chin, really remarkable change. Let's look at another one. Christy's chief complaint was she did not like her gummy smile. She would say that when she would speak or eat, her jaw would pop. You can see the symmetry change. The gummy smile is gone. Complete different, transformed profile. Honestly, it looks like she lost like 10 years off of her life. And drawing these lines really can show you the difference in symmetry and how much of an improvement has occurred. You see how the jaw is behind that line? You really want that jaw in front of that line. The chin should always be in front. So you can see in the comparison of these two images how successful the expansion was. And even the way that she leaned her head forward in that first image, you see how she's standing more backward in the second image. And she had some really great things to say after treatment. One of them was, when smiling, I noticed that I am now physically unable to smile as big as I used to. My gums are now barely showing, and my face feels different when I smile now. I don't know how to explain it, but it is a great thing. The other testimonial that she mentioned was, when I speak and eat, my jaw no longer pops. I can speak more clearly and feel a noticeable difference in the amount of room my tongue has. I can breathe very well through my nose. I am very happy with the result. These are the testimonies that we really strive for patients to be able to say after they're finished with treatment. Okay, so what is the goal here? What are we trying to accomplish? What can we do to get that great expansion? We want to promote healthy nasal breathing. Want to discourage and eliminate mouth breathing. Nasal breathing prepares the air by filtering, warming, and moisturizing for optimal assimilation into the lungs. We want to train the tongue, strengthen, condition, reposition the tongue upward and forward, and promote proper swallowing and speech. And we want to eliminate bad habits, thumb sucking, thrusting the tongue, or reverse swallow. All right, so what are you going to expect when you come into our office? Well, we're going to do a combination of screening, medical imaging, and diagnostics. So the first visit is going to be a conversation with you of how you're feeling, what you're experiencing. What specific symptoms are you having? We have a questionnaire that you'll do to kind of give us an idea of how you're sleeping at night, how rested you feel during the day. And then if we believe that there is something there and something we need to look more deeper into, then we're going to prescribe a sleep ring that you'll go home with to do a proper sleep study. We'll do a CT scan. This will allow us to look at your jaw placement, how wide your upper and lower jaw are, how narrow your airway may be as well. And then when all of that information comes back, we'll do a diagnostic review and protocol. And this will be a collaborative review. We have a team of doctors that works with us, from ENTs to chiropractors to sleep doctors to physicians. Everyone will come together and make the best decision for your health. So I want to thank you so much for what you learned today. I hope this was enough information to help you understand exactly what's happening in your life, the life of the people that you love. At the end of this presentation, let's schedule an appointment and come in for an evaluation, and let's get you breathing and feeling better. Thank you so much for spending this hour with me. I am Dr. Letitia Plummer, and I am so happy that you've trusted us, our office, to join you on this journey of breathing and feeling well.
I really feel like VIVOS is one of the great answers to the healthcare crisis that's in America, because we're getting to the root cause of what ails a lot of us, and that is not breathing well and not sleeping well.
If you trace back the journey of a sleep apnea patient, that patient is suffering for years before they ever get diagnosed. Once they are diagnosed, they're presented really with two fundamental options. You can go into CPAP and wear a contraption over your face every night for the rest of your life, or you can have what's called a mandibular advancement device, which will actually protrude your lower jaw in an unnatural position to hold your airway open while you sleep, and you can wear that for the rest of your life. Either of those two modalities are going to present that patient with a life sentence of having to wear this contraption, one or the other, every night for the rest of their life.
The interesting thing about CPAP and oral appliances is, although they're very effective treatments, if they're used over a lifetime, the person's condition actually gets worse over time.
Along comes VIVOS and says, wait a minute, we have a better option that's all natural, non-invasive, non-pharmaceutical. We can say to a patient, you go into this oral appliance therapy with our protocols, and you go through this treatment for 12 to 24 months. And at the end of that time, there's a high probability that you will no longer have to wear an appliance or any kind of device.
VIVOS is literally changing my patients' lives.
It has drastically changed my life. I don't have to use the CPAP anymore. Within just a couple weeks of using the appliance, I was able to breathe through both nostrils, something I couldn't do my entire life. This was revolutionary. Pretty much made me feel excited about life again.
She's sleeping better, I'm sleeping better.
You really feel like you've been given a new life.
It's amazing. I wake up and I'm not in pain.
Because she's sleeping better, is her attitude during the day is better.
I have a better quality of life now. I can't say enough good about it.
I'm getting instant benefit from it. I was amazed. I dreamed every night for 2 weeks straight, and I told my wife, I said, it's amazing. I feel sharp now. I don't feel drowsy all the time. It's been a long time since I felt this good. I wouldn't lay down and try to sleep right now without my VIVOS device.
My asthma has gotten much, much better. Without the VIVOS, I wouldn't be outside right now. There's no numerical value you can put on this kind of a change. I smile, and I haven't smiled for a long time.
Right after I started using it, I noticed the results really, especially with the snoring. My sleep apnea episodes are a fraction of what they were before. This product's phenomenal. It changed my life.
It's a very comfortable process, but I can see dramatic differences. Now I can really open my mouth. Before it would almost always click.
His ADHD is calming down, he's doing better in school. I can definitely see the difference and the change in him. It's a miracle.
I get to do things now that I would not have been able to. I would not hesitate to do it again.
I am 100% happy that I did this, and I'm thankful every day that I have it because I can breathe.
We bring hope to the millions of people and the millions of families, men, women, and children who suffer from this disease.
It promotes the body's own ability to heal itself because now the body can breathe and sleep well. That's exciting.